Last day I made a speech about the COVID-19, especially the new variant Omicron. That speech was in Malayalam. Now I am talking about the same subject in English. We all are in a new threat. Already a threat is just finished. Second wave, it has reached in the peak of that time 4.5 lakh total active patients. After that, it take more months to decrease. 5 days before, it has reached in 18,000. After that, the sign of the third wave was seen not only in India, throughout the world, in Europe, in Britain, America. The cases are increasing and a lack of daily positive cases are reporting. As part of that, in India, raised the case, many problems may come because the sudden rise of the patients, the number of patients will lead critical problem because our health mechanism cannot bear that, cannot tolerate that. The sudden increase of the patient comes, that time complicated cases will be increased and more patient need hospitalization. That time our ICU facility is limited, our ventilator facility is limited, our oxygen availability is limited. I am not just saying this. We have seen it in the time of second wave in Delhi. There are the scarcity of oxygen cylinder. No vacancy in ICU. Ventilator facilities not so available for the needed cases. So many deaths happened in Delhi. I think that Delhi is much better than the Kerala health system because many hospital and other things are there. Famous hospital and many highly experienced doctors are there. Even in Delhi, the crisis come when the patient's rate is increased. That time, many death cases come and there is no place to cremate the body. The ambulance are standing in a queue for kilometers, 2 and 5 kilometers long queue for the cremation of the body. Some relates, they decided to throw the relaxed body into river. Many dead bodies we can see in the river at that time. The pathetic situation, the same situation are repeated in Italy in the time of the first wave. Italy government warned the people, but they haven't taken it seriously. After that, as a result of that, many persons were infected with the COVID-19. Naturally, the complication cases will be increased. If the total number of the patients increased, definitely the complication cases will be increased. In Italy itself, many people died because of the lack of treatment. Because there is no facility. The old persons is not treating properly because they are old, taking the ventilator and it is giving to the young people in Italy. The Malayali nurses working in the Italy, they have put many videos in the WhatsApp and other social media. We have seen it and we have seen their explanation. The same situation is repeated in Delhi. Many states of the India, many of the states, the COVID-19 cases decreased very earlier. But in Kerala, the COVID came very late. After it was infected in many states of the India, when it come to Kerala, that time many of the states, the cases has decreased there. But Kerala, it increased and it got peak of 4.5 lakhs total active patient. In the recent time, I told you that 5 days before, it has reached 18,000. After that, the presence of the third wave started in India. As part of New Year celebration and the Christmas celebrations, the people are mingling uncontrollably without using any precautions to prevent the diseases. I think that because of that, the sudden increases seen in the case of the COVID-19. As per the statistics of the government, Omicron variant is very less now. But in other states of the India, the gradual increases seen in the infected Omicron cases. In India, the ICMR confirmed the community spreading of Omicron variant. Definitely, it will come here. The community spreading of the Omicron variant will be happen here because when Delta come here and we have done a lockout, the total lockdown, shutdown we have conducted. After the community spreading happened, we haven't continued the lockdown. We have lifted all restrictions. Some people ask why the first time they have imposed the total lockdown. Now the cases are increasing. There is no lockdown. What is the use of the lockdown in the first time of the disease? They are asking. In the first time, the intention of the lockdown is to prevent the community spreading. In India, community spreading already happened now because community spreading already done here. Lockdown is imposed earlier to prevent the community spreading. Persons, they have no livelihood, job, nothing, and financial crises are rising. Shop and establishment totally locked. Many people has felt many inconvenience. Same situation is coming, but I don't think that the government will not impose any lockdown. The partial lockdown sometimes we can hope. Most probably it will be in the night time from 9 p.m. to 6 p.m. Maybe it is, or we can hope weekend lockdown also. And some restrictions, the restriction already announced by the government. The marriage function will not be allowed more than 50 persons. Other public gathering should not be exceeded 50 people. These restrictions will be imposed, and vaccination program should be strengthened. People belong to the age of 15 and 18. The students, they are now vaccinating. If 50% of that group was already vaccinated, and after that a booster dose is required for the elders, especially the most risk groups. In that group, health workers and other most mingling publics are included. The people above 60 years, they can also take their vaccination if they have a gap of 9 months from their last vaccination. Already it has started, and vaccination program is the very important thing because it will reduce the death cases. As per the Indian statistics, ICMR released statistics, most of the death cases is from unvaccinated group. The percent of the vaccinated group is very less in that, because vaccine will prevent the complications of the diseases. But the main threat is that the communal spreading. If the communal spreading happened, the number of patients will be increased, and our facilities, our health facilities will not be able to manage that situation. As a result of that, the complicated patients, they will not get the proper treatment, and they will be died. So the death cases will be increased in case of community spreading happened, because our health system cannot tolerate that. It is too high than our capacity. So we all are bound to control ourselves. The spreading should be controlled by precautions. Every person can do that. They can keep a distance from at least 2 meters from a person, and they should wear the mask properly, and they should take the vaccine properly. If they feel any symptoms of the common flu and a common cold, they should not enter into society. They should not mingle with the people inside the house. They should go self-isolation. We can reduce the speed of that. So we will get enough time to manage that. The cases are increasing. That time our health system will be helpless, because we have seen it in Delhi. Many people died because of lack of treatment. There is no ventilator free, there is no oxygen supply, and doctor staff, many problems are facing. There is no PPE kit even. It's a real, it's not a story. Happened just 1 year before. We must all remember that. Some people are saying the COVID-19 not a disease, it will go and come. This thinking, this persons, they have no social responsibility. Sometimes they will be survived, but the disease will be transmitted to others. If you are a responsible citizen, you have to keep all restrictions imposed by the government, and all precaution which is advised by the WHO, we should compulsory obey that. Here we are conducting this program. Here is only less than 20%. They are keeping so many distance, keeping about 2 meters. They are sitting on the chair. Chair is fully free here. Only limited persons are here. I am standing 2 distance from you because now I am not using mask. We have enough distance between us. Okay.